Welcome to the second in our Quality Framework bite-sized sessions. In this session, we're going to focus on how the Quality Framework can be used to support self-evaluation. Self-evaluation is your opportunity to reflect on what your service does well and to identify what you could do better. It should establish a baseline or starting point from which you can put plans in place with clear priorities for actions that will improve outcomes for children, their families, and the staff within your service. Used effectively, continuous self-evaluation helps monitor progress and measure the impact that your changes have made. Self-evaluation is a core part of assuring quality and supporting improvement. As part of a wider quality assurance approach, this requires an ongoing cycle of self-evaluation. To support you with how to evaluate your service, the Care Inspectorate have developed the document Self-Evaluation for Improvement, Your Guide. This can be found on our hub and on the link below this recording. The cycle of self-evaluation is based around three questions, which are highlighted in purple. How are we doing? How do we know? And what are we going to do now? These can be applied to any of the key questions within the quality framework, which are highlighted in green. The first question, how are we doing, is key to knowing whether you are doing the right things and that, as a result, people experience high quality, safe and compassionate care and support that meets their needs, rights and choices. Answering the question, how do we know, must be done based on robust evidence. The quality indicators in the framework, along with the views of people experiencing care and support and their carers, can help you evaluate how you are doing. Then we move on to think about what are we going to do now. Understanding how well your service is performing should help you see what is working well and what needs to be improved. From that, you should be able to develop plans for improvement based on effective practice, guidance, research, testing, and available improvement support. The key to writing a quality self-evaluation is to use evaluative language. Try not to list a series of descriptive comments. A useful trick is to apply the "so what" question to everything you have written. So what does that mean to the children in our care, their families, and our staff team? Here are a few examples of evaluative language. This is by no means an exhaustive list, but merely a few suggestions to get you started. Try to move away from bullet-pointed lists, which tells us nothing about the impact the work you are doing is having on the people who use or work within your service. Here is an example from 1.1, Nurturing Care and Support. You can see how the 3 bullet points have been combined into a statement which shares the impact on the children. We have highlighted in yellow the examples of evaluative language used. The health and social care standards underpin your practice. Make sure you can demonstrate through your evaluations how you are meeting the needs of the children and families who use your service. Consider which health and social care standards are the most relevant for your service, children and families. Remember to consider the relevant best practice documents underpinning the work you are doing. How are you reflecting and evaluating this both in your practice and in your self-evaluation? Please look out for our next bite-sized sessions where we will explore examples of self-evaluation in different ELC contexts. If you have found this session useful, please feel free to tweet about it using the hashtag ELCimprove, or for more information about the programme, please contact the ELC Improve mailbox.